Good afternoon, everyone. My name is Alicia St. Hill Nasser. I'm the Manager of Health Informatics at BORN, Ontario. I'd like to welcome you to February's provincial rounds, which is focused on enhancing immunization data collection in Ottawa through the ImmunizeCA app. We will be presenting to you over the next 30 to 40 minutes, myself and Catherine Atkinson, who I'll introduce shortly. But during that time, we would ask you can use the chat box at the bottom of your screen to enter in any questions that you have as the presentation is ongoing. There will be a question and answer period that will occur at the end of our presentation. So please feel free to type your questions in the chat box and we'll answer them then. I'm also going to unmute the line at that time, so if you want to just hold off on your questions until the end, we can have a bit of a conversation as well. As you may have heard, as you joined into the conference call today, these rounds are being recorded and it will be posted on our BORN Ontario website. So I want to introduce you today to Catherine Atkinson. She is the research coordinator at the Ottawa Hospital Research Institute. She's interested in how new technologies can be applied to address challenges in public health, specifically on evaluating the impact of mobile technologies such as apps on immunization practice. This includes their potential to improve adherence to on-time vaccination, as well as how they can assist with program evaluation and vaccine safety surveillance. And I'm Alicia St. Hill Nasser. I'm the Manager of Health Informatics at BORN. I've been working closely with Catherine and other partners on the pilot project that we'll describe to you a little bit later. And I'm really excited to share with you some of these new innovations that we can do through our role as a registry and in working with innovators like Catherine and her team. Okay. So this morning's objectives are to introduce the ImmunizeCA app that helps families manage their immunizations. We'll describe to you that app in a lot of detail so you can get to know a little bit more about where this information is being stored. Then we're going to describe to you a bit of a pilot that we are going to start in the coming months, where we're going to allow for information exchange between ImmunizeCA and BORN and public health units to facilitate better access to immunization coverage information. And we'll just have a short discussion on the opportunities that a registry has to leverage mHealth to deliver specialized and focused care.
Great. Well, thank you, Alicia, and I'm really happy to be here today to speak to you all about our work around ImmunizeCA, as well as how we can collaborate with registries like BORN to really leverage these solutions. So this all started quite a few years ago, back in 2012, and we received some feedback from a fellow parent to Dr. Wilson saying it's really hard to keep track of all of my immunization records, and I can do everything on my phone. I can do banking, I can make purchases. Why am I supposed to keep all my immunization records on a piece of paper? Can't we put it on the phone? So as I mentioned, this happened in spring of 2012, and here's a picture of Dr. Kuhn Wilson with Leslie Keenan, the mother who approached him in the park. So all of this work and this idea about putting the yellow card on the phone resulted in a prototype app called ImmunizeOn. It was first released in November of 2012, and it was only for iPhones or for the iTunes App Store. As far as we know, it was the first digital immunization record of its kind. The really big learning experience with ImmunizeOn is that you actually just have to build these apps and get them out. As soon as you get it live and have people start to use it, they're going to give you a lot of feedback. So we received quite a bit of feedback from our users in terms of emails and bug reports, so we're able to rapidly iterate the product in real time. And we also learned from ImmunizeOn the importance of creating a very user-friendly interface. So immunization schedules can be complex, and is there a way to use mobile technologies to present them in a very simple manner? So we initially put these features in ImmunizeOn, and we realized there's a whole lot more that we can do with this. In order to make that happen and to kind of realize a broader vision with ImmunizeOn, we created some new partnerships. So the first app, ImmunizeOn, was developed by the Ottawa Hospital Research Institute. We partnered with the Canadian Public Health Association and Immunize Canada on this new partnership to realize this vision, and all this work was funded by the Public Health Agency of Canada. Our goal with this next version of the app was to not only expand it to other users, so on Android and compatible BlackBerry platforms, but to create it in both official languages, so both in English and French, as well as not only to create it for Ontario, but for every province and territory in Canada. So in March 2014, ImmunizeCA was released. As I mentioned, we launched it for all three platforms, so iOS, Android, and compatible BlackBerry phones. It was in both official languages, so English and French. And as you see on the bottom there, it took the yellow card and put it directly on the phone. It had the same view of schedules that ImmunizeOn did, so a really user-friendly way to present rather complex information. As well as I mentioned, there was a whole lot more that we could do with this, and I'll take you through a few of those features now. After I tell you a little bit about how uptake has gone. So what you're seeing here on the top graph, on the horizontal axis is time. So we launched in March, and on the vertical axis is new users in dark blue, and in light blue, total number of users. It's a bit hard to see, but when I took this graph a few days ago, we were up to 70,000, almost 71,000 users. And as you can see, we had a lot of uptake right off the bat, leveled out during the summer, and we see another peak in late July, and we're seeing some other peaks in usage over time. You can see in the bottom left-hand corner of the map, we have fairly even distribution of app uptake in major cities across the country. We've also had great endorsement from key political spokespeople for public health. You see Dr. Taylor and Minister Ambrose demonstrating the app, as well as our Ontario Minister of Health, Dr. Eric Hoskins, tweeting about the app. So as I mentioned, just a little more information that we can draw from our analytics around the usage of ImmunizeCA. So I took this yesterday. We have over 71,000 users, over 250,000 sessions, so actually numbers of time people are engaging with the app, 1.3 million screen views. So we know people are actually using this, not just downloading it, but they're using it often, and when they are using it, they're engaging fairly heavily with it. So an average of over 5 screens a session. And we're only about 28.1% new sessions. That means a lot of our users are coming back over and over again into the app. So I mentioned, there's a lot that we could do with this, and one of those opportunities we found was the ability to communicate with our users in real time. So when you first log into the app, you'll see 4 quadrants: My Records, Notifications, Information, and a search function. And on top of those 4 quadrants are rotating banners. Underneath those banners, there's a byline and a click-through to learn more about the information. So we can change these banners in real time through our backend system with no update required by the user. So at any one time, we usually have about 5 or 6 banners. And we can link out, as I mentioned, to external sources of information. And this really enables us to push information to the public that's important to them in real time. In one of our updates later this year, we also created the ability to filter that information based on location. So based on what city you've selected as your city of residence, as well as your province, we can actually create a custom set of banners specifically for you. So another feature of ImmunizeCA is not only to track your immunizations, but you can create profiles for your whole family and keep them all in one place. So when you click into My Records on your home screen, you're going to go to this view, which is the list of profiles in your app. To create a new record, you'll see the view on the left. It asks you for first name, last name, your date of birth, your province, and now it'll ask you your city of residence, as in your gender. You have the option to also include health card and your physician. Based on all of the provincial and territorial schedules, which are programmed to the back end of our application, and we have both pediatric and adults, so we've got 28 schedules, as well as the birth date, province, and gender, we create a specific tailored schedule for that profile. So what you see on the right is an example of an Ontario pediatric schedule. So we've broken down all the immunizations by visit, and you'll see in green the ones that are completed, in red overdue, and in yellow upcoming or approaching. You'll see on the right-hand column we've included the dates associated with each schedule, and you can use appointment reminders, and the app will sync to your calendar function for your smartphone to schedule these appointments. This is a view, for instance, of the 2-month visit. So it'll show you on the left-hand view the immunizations which are recommended and publicly funded during that visit. If you were to, for instance, click on the DTaP IPV Hib, it'll bring up the middle view. So it'll outline for you which antigens are included within that immunization. To indicate that it's been received, you simply toggle that green button from no to yes. It'll default to the date that's recommended, but to change it, if you're a little bit off schedule, you just open up that and change the date. If you'd like more information on that vaccine, you can click on that button. It'll bring you to the far right-hand view, which is the full provincial immunization fact sheet. Underneath, we've also included some plain language brief summaries of some of the commonly asked questions about each immunization. So what are the benefits of this vaccine and who should get this vaccine? All of that information has been plain language to a grade 7-8 reading level, and this provides individuals with the option of understanding very quickly a little bit about the immunization or actually interacting with very in-depth information through things like the provincial fact sheet. So I told you a little bit about how the app came about and how our distribution and our dissemination work has been, and also how the app works. One of the interesting parts about this is seeing who's using our app. So almost half of our users are actually residents of Ontario. We can see through analytics software that a lot of them are in Toronto, and then Ottawa and suburbs like Brampton and London are also heavily represented. One of the challenges of working immunization is capturing the right age of individuals. So when we took a look, actually almost 60% of our records are under 5 years old, and a total of 30% are actually under the age of 1. We have records as old as 93 years old, so it seems that a lot of different people are using this app. And why is this all important? So we developed this app in response to a mother who said it's really difficult to keep track of her immunizations, and while she uses her phone for everything, can't we, put the immunizations on the phone? And through this, we've realized not only there's a lot more we can do with this, but to create a solution for the individual, but there's also an opportunity to increase surveillance and actually improve the system. And there's many challenges with the way that immunization is currently being evaluated in Canada, and this month has been of particular relevance as we've seen outbreaks of measles all throughout the province. And it's hard to understand exactly why that's occurring. So could it be, vaccine confidence? People believe that vaccines aren't safe or necessary, so they're not actually getting vaccinated. Is it that we don't know who has been vaccinated and not, so we're not able to follow up with them? Is it that the vaccines aren't working correctly? Without all of this information, it's really hard to tease out what the challenges are. This week and today on the radio in Ottawa, we heard a lot about the challenges of local public health units and keeping track of this information and monitoring coverage of vaccine surveillance. So I'll hand it over to Alicia, who will tell you about the work that we're doing together to try and mitigate these challenges.
Mm-hmm. So what we're going to talk about now is basically how we are leveraging our registry role as a prescribed registry under PHEPA to be at the center of trying to connect that ImmunizeCA record that parents and families have in their hands with those who need it, like public health units. So you can, back in, I think it was about 2010, Dr. Wilson from the Ottawa Hospital Research Institute, as well as Dr. Pranish Chakraborty, our medical director of BORN, and Mari Teitelbaum, our former director at BORN, we're having conversations about the need for some way of improving coverage, but also being able to monitor coverage and to have that record be more accessible, which is where some of the app creation generated from. But as the app was created, more conversations and more thoughts led to, imagine if we could actually link the records in the app to those who need it directly, and what would that look like? So, of course, we had to first think about what are the benefits of even exchanging this data. I think for most of you on the phone, it's going to be very obvious. But because immunizations are offered in so many different locations, not always from the same provider, perhaps now with even pharmacies being involved, public health units offering clinics, parents really are a valid source of truth on the full immunization record of their children. And public health units in Ontario, as we're hearing in the news a lot, are mandated to monitor adherence to immunization schedules for children in schools and in daycare centers, but they require that to be reported by parents directly. And right now the only options are paper-based. Some public health units offer web portals that require you to go in and duplicate that information, or to fax in a copy of the yellow card, which hopefully you've kept up to date as you've visited your various providers over the years. Public health units have obligation as well to monitor and trend coverage rates. So really their need to understand full coverage for the entire population is tantamount. What we also know about exchanging information, especially on preschool-age children, is that the opportunities for public health units to collect this information on preschool-age children is very, very few. Generally, before school registration, public health doesn't have a very good sense of what the coverage rates are of children between 0 to 5 years of age. Yet, if you look at the provincial immunization schedule, the vast majority of immunizations actually are, most of the schedule is actually before 18 months, with a booster happening at 4 to 6 years. So we know that a high level of users will actually be parents of young children who are filling in this information as the immunizations are happening. And we've hit a crucial moment of time when exchanging information will be important. Now, as a registry, we have this mandate to facilitate care at the individual level. And so an mHealth app like what we're talking about today gets us to information at that individualized level for collection, but also for sharing with important and key players in the health system. And given the importance of immunization status and the growing momentum here, a registry can play a role in being able to store and share immunization in between providers. So imagine not having to bring your yellow card from place to place so that everyone would know it was updated. To capture adverse events, potentially those adverse events in association with an immunization. To centralize population data to make trending and analysis more easy and easier to access. And also identifying at-risk populations or individuals who haven't received vaccines or areas or locations where vaccine coverage isn't as great. And so BORN, as a registry with the mandate of both maternal and child health, we have a role to play potentially in the immunization piece related to child vaccinations. So the solution. So our pilot, the conversations turned into real next steps and really looking at what is it we could do, partnering with ImmunizeCA. And so we've solutioned the following information flow you see on your screen. So parents now, and as you mentioned earlier, this pilot is actually happening with Ottawa Public Health Unit first, and we hope to go live within the next couple of months, where parents would be able to use their ImmunizeCA app to consent to sharing their information with Ottawa Public Health. That information will flow through the BORN information system and be available to Ottawa Public Health BORN report portal, all securely accessed through the BIS, to identify and to locate full records of all the information that's been transmitted from each parent, each child, each family. At this time, it will stay in the format of a report, and Ottawa Public Health will then use that report to enter the information into their immunization records information system, or the panorama system that's been rolled out to public health units in Ontario. The report would be actually filterable as well, so it's not going to be like everything you've ever received, but public health units, to be able to manage their business workflow a little bit better, will be able to filter that information based on the date of transmission of the record from the parent, so that they can keep track of what they've already entered. They would be able to filter that report by the immunization type, or even perhaps by patient age, if that was what was important. And we'll be transmitting this information for children ages 16 years and under. To start. So as a parent logs in or is using the app, they'll be offered through a bottom banner you see on the first screenshot of an iPhone here, the ability to transmit your information to Ottawa Public Health. But clicking on that banner, they're going to have to enter in a little bit more information than they would have initially entered when they started the child's record. So we will need information like the child's health card number, phone numbers of the parent, parent name, relationship to the child, and I believe that's the majority of the information that they would need, similar to what is required by public health units today when they're collecting information from parents. And so all of this will be provided with easy touch access to their iPhone to just enter the information and then consent to sharing the information with their local public health unit. Based on the city that the person lives in, we'll be able to decide which public health unit that record would go to. And we have had some discussions, although to start we aren't going to collect it, but there are some discussions about capturing school of the child within the app as well. But we're going to see how this first pilot goes first. So certainly the benefits to the public health unit receiving this, so Ottawa Public Health, is that they've now created an additional and novel and persistent source of vaccination data. So now parents will have another alternative, and perhaps it will be more efficient than the traditional methods of getting information to public health units, either through their school or through fax or telephone. The data will persist within the BORN registry, so in the event that a public health unit gets behind in their data collection or reporting of that information, they can always go back to the biz to see all the records that have been transmitted to the public health unit for all of time. And as I know, we mentioned this pilot shortly at our recent BORN conference, and one of the other public health units in the audience asked, will there be any direct connectivity to your panorama system that is used right now by different public health units? The answer is no, not this time, but we certainly see a future where direct connectivity between the app, BORN, and the public health central repository would be a valuable reduction of the burden of manual data entry that public health units have right now. So on your screen, we thought we'd share, a colleague of Catherine shared this flyer with her not too long ago. And this is a flyer that Toronto Public Health puts out to parents. And basically says, you know, to avoid suspension, make sure that your immunization record is up to date. And you can do that in one of two ways, either by going online or faxing us this information, or even in Toronto's case, they're taking direct email. However, you can imagine that at some point, there may be the opportunity to use the ImmunizeCA app and submit this record to your public health unit as an option of getting that record from your family to your to the public health unit. Now's the time to kind of sit back and think about, you know, what else could the future bring for the partnership between ImmunizeCA and BORN. Certainly our hope is that that if this feature is successful in Ottawa and people see the value in using it, and that public health units get the value, the unit value they're hoping to get out of it, and that we're able to increase the coverage, because that'll be an important indicator of the evaluation, is that we provide this feature to other public health jurisdictions in Ontario and hope that they can improve their capture as well of immunization records. We also have talked a bit about, and certainly primary care physicians are on side with this, and I'm sure parents are too, is to leverage some of the work that BORN has done with primary care to hopefully offer us up some bidirectional sharing of immunization data between families and providers via the app, and using the BORN information system, again, as an in-between, where we have the ability to authenticate who, in fact, should be receiving these records. And that's a very important privacy and security pillar of all the work we do, is to make sure that if we're ever going to get into bidirectional flow, that we're sure that we're sharing this with the people who are supposed to be within the circle of care. The other piece that's not up here is that we could also use the app to identify and collect adverse events associated with recent immunization. That is an important piece of information that, public health information that we always want to keep attuned to. And so certainly this would provide an opportunity for parents to use the same app they use to collect the information to also report an adverse event, and be able to improve our adverse reporting, which we know could use some improving in Ontario and in the nation as a whole.
Yeah, Alicia, that's a really good point. And this past fall, we did a pilot with an adverse event reporting app through the Canadian Immunization Research Network. And we learned a lot from this pilot as well. And we think it's best to include this kind of functionality in a larger application that will increase the perceived usefulness of this kind of a tool. And I think if we're able to collect not only immunization records, but create the ability for individuals to report post-immunization experience with public health, as well as allow this information to be shared not only with public health, but providers and individuals, we're really going to be able to increase the value of the information for all stakeholders.
So one of our last objectives on this call was actually to think about how we could leverage mHealth to obtain better outcomes in other areas. So certainly what OHRI has done and their partners have done around the ImmunizeCA app is extremely innovative. And as Catherine said, with just a few pieces of information are able to tailor a personalized immunization pathway or schedule for that member of the family. And we know that individuals and families really do mobilize to improve their own health care outcomes when they're informed with really clear information and really clear next steps. So at BORN, as we think about some of the ways in which we could connect to improve health outcomes in the end, we think about the leveraging personal health records like these apps, where perhaps mothers who've experienced gestational hypertension in pregnancy can manage their postpartum outcomes and manage postpartum follow-up and obtain screening in the postpartum period through mobile technology. That would be a novel way of having the population served by the gathered or collected information within the registry. Similarly, you could do similar stuff with gestational diabetes follow-up, ensuring that people are receiving the screening notifications or reminders within that 6-week to 3-month period postpartum. We know that the system is really moving to include people in healthcare provision, and we think that mHealth is one of the ways that we can really get at that improved facilitation of care by using apps like this or others to keep patients in the center and keep them informed of their health care. So I want to thank you. I know we only took about 30 minutes of your time this afternoon. Thank you for listening to our presentation, and we're happy to take any questions. I'm just going to ask Val to unmute the line. So if you don't mind, as with any other teleconference, if you could just speak up and be respectful of the other people on the call to ask one question at a time, please. Any questions from anyone on the line? Okay.
Is there any text box questions? Or?
No, I don't see any. Okay, then. If there are no more questions, I will close by thanking you all for attending. We will not be having a BORN provincial rounds next month due to March break, but our next scheduled rounds will be on April 16th, so mark your calendars. At that round, we'll hear from Dr. Beth Murray-Davis, who's a registered midwife and assistant professor with the Department of Obstetrics and Gynecology, Division of Midwifery at McMaster University, on her research deciding on home or hospital birth, the results of an Ontario Choice of Birthplace Survey. Oh, we do have a question from Karen. She's going to type it to us, so just please bear with us. So there's a question coming in from the Ministry of Health. Okay.
So we have two questions, looks like one from Nicole as well as I think we'll address the question from the minister. Oh, there's a few, eh?
Let's see here. So first question, sorry, it's taken a little while. Curious to know why BORN intends to replicate provincial immunization registry function. So certainly we are not looking to duplicate the provincial immunization registry function, but rather to offer this opportunity, which we see within child health, to transmit this information because we can provide this information to public health units directly. We have always and tried to connect with Panorama teams to try and see how we could provide this information directly to a centralized provincial registry, and are still open to having those kinds of conversations now. And so it's not considered duplication, but rather a new feature we'd like to offer up to individuals in the community. Let's see if I can unmute everyone.
And although I don't speak for BORN at all, and I'm sure Alicia would have more to elaborate on this, from what I understood, you guys grew through maternal and child health, and as you grew into the 18-month well baby visit, one of the key parts of a young child's life is immunization. And I think starting in that way is seeing if you can get parents empowered to communicate around their children's health and reporting about, key milestones in early childhood is a very interesting opportunity for research and for improving provision of health and communicating with providers. So I think this seems like a low-hanging fruit.
And so another question here from Nicole Callahan. How do we share the data in the app with my family physician or the school? It's a good question. So at this time, maybe Kathy, you want to answer that?
Thanks, Nicole. That's a great question. At this time, the information that you've inputted into ImmunizeCA resides only on your phone. We're looking into ways of backing up this information in a more robust way for yourself, but this pilot that we're doing with BORN is really the first time we're looking at creating an information exchange mechanism. As Alicia mentioned, BORN has a very special mandate and privacy clearance to disclose this information. At this time, we don't have any mechanism to share with a school or a physician, but I think as BORN creates additional linkages to EMRs and is really working to create those connections, that would be a really wonderful place to go in the future.
There's a question here about will the immunization data be retained in BORN? Yes, it will persist in BORN, as I mentioned, the data that flows through. And you're welcome, Nicole.
We're just looking through to make sure that we've understood everyone's questions and we've answered them. Okay. So if there are no more questions, apologies again for not being able to unmute, it seems, all of your line, despite trying to make that function happen. We appreciate you using the chat boxes to communicate with us. If there are any further questions, this presentation will be posted online, and I believe our contact information is associated with it on the BORN website, which is bornontario.ca. So thank you all and have a great day.